Basically, it's a bacteria that's passed by contact with it. It is not spread through the air like, say, measles, which we've heard a lot about, or the flu. Also, the main thing norovirus has in common with measles and the flu is how contagious it is.
Hello and welcome to the AMA Update video and podcast. Today we're talking about norovirus, including where it spreads, how to prevent outbreaks, and why it's been surging. Joining us today in our studio is Dr. Joanna Bisgrove. Dr. Bisgrove is a family physician at Rush University Medical Center right here in Chicago. And she's also a member of the AMA Council on Science and Public Health. Couldn't have a better person to talk to today. I'm Todd Unger, AMA's Chief Experience Officer. Welcome, Dr. Bisgrove.
Thank you so much, Todd. It's great to be here and great to be local.
Great to have you here and great to have someone from Rush, one of our new health system partners here in Chicago. And I can see you've got the Cubs colors going.
Yes, I am a diehard Cubs fan, and many in the AMA know that. And this is one of my favorite professional suits to wear because it's the Cubs, it's spring, and my whole family is excited.
Well, that's fantastic. Well, thanks for joining us.
Yeah.
I'm going to tell you what, talking about norovirus is about as close to norovirus as I want to get. And I got a lot of questions for you today, so we're going to get into that. I think, people out there are probably confused. There's so many things and reasons that people seem to, get sick. But let's talk specifically, what is norovirus? How do you diagnose it, and what do you do about it?
So norovirus is a virus, obviously. It is passed through what they call the fecal-oral route. Basically, it's a bacteria that's passed by contact with it. It is not spread through the air like, say, measles, which we've heard a lot about, or the flu. Also, the main thing norovirus has in common with measles and the flu is how contagious it is. Beyond that, the similarities really end. The other two are spread by air or vaccine preventable. Norovirus is a very, very different thing. It is spread by contact with surfaces. It's the little bugger that can live on surfaces for quite a long time and also be shed by people long after they've been sick. So it is something that's like washing your hands is so important to keep it from spreading. Keeping surfaces clean, it's commonly spread. I don't know, most commonly spread, but it's very, very commonly spread in food setting just because people were not washing their hands, were not cleaning surfaces properly with the proper high-grade disinfectants. And so, yeah, it is a tough and easily spread thing.
So you mentioned very contagious.
Yes.
All over surfaces, and it lasts a long time.
Yes.
You have some personal experience for just how long this lasts.
Yes,
to give folks a flavor.
I do. So when I was pregnant with my now 18-year-old, I was about 36 weeks pregnant, and we had friends coming over to help with setting up the crib, and the wife had been sick. And we thought she had norovirus, and so I had asked, please stay home, don't come with. But she'd been feeling better for a couple of days, so the husband's like, oh, come along. I was not home. I was on call as a third-year resident. So I came home after they left, went to the bathroom, settled in, and went to sleep. What I did not realize is she had used that same one bathroom in our one-bedroom apartment at the time to go to the bathroom as well. And I think it was a couple of hours, but still, she was still shedding, even though didn't realize that. I didn't realize she had been there, so I didn't think to clean the seat. I was sick within 24 hours. And when you're 35 weeks pregnant, sick, throwing up, vomiting, diarrhea, which are the common symptoms of norovirus, it's not fun. I mean, Katie, my oldest, was kicking away, very happy, and I was so sore. I was like, please, child, I love you, but come on now. We did go to labor and delivery. They checked me out. Baby looked fine, but they're like, yeah, this is probably norovirus. And then I got better, was feeling better. They said, you can go home. I barely avoided being admitted for observation for that.
That's a hard story to
Yes,
hear.
it's one I tell often because it explains a lot about how norovirus works and how sick you can get.
You mentioned something just in that statement. They said it's probably norovirus. How do you know if you have norovirus, if you have some other kind of stomach bug or something like listeria, which can have a real impact on different organs and things like that?
Usually, you are correct. Typically, it's the clinical diagnosis. So we make it by what the symptoms are, by being really, really ill, whether there's potential exposure to something, say listeria. Listeria frequently found in deli meat. It's like, what's the exposure pattern? Because a lot of times with viruses, it's who were you near, what were the exposures, what was going on. We knew my friend hadn't had any deli meat. The symptoms were about 2 to 3 days for her, so we knew that, like, most likely, clinically speaking, it was norovirus. So a lot of times, sometimes it could look like food poisoning, just because food poisoning also is very short, but if it lasts longer than 24 hours, like 2 to 3 days, most likely norovirus. Like I said, you can test, frequently people don't. They can in the hospital if it's absolutely needed, but most of the time it is a clinical diagnosis.
So in rank order, food poisoning shorter, norovirus 2 to 3 days, exhaustion after that, and then maybe something like a listeria, depending on what you said. Do you have history associated with typical causes?
Yeah, and bacteria, usually bacterial diarrhea lasts a lot longer. So we frequently tell people, if you're still, after a week or two, still having lots of problems, go and get tested, because norovirus and other viruses frequently don't act like that, especially norovirus. It does not act like that. It is quick, it is obnoxious, but it's quick.
Well, I guess that's one upside.
Yes.
I've heard about norovirus for a long time. I kind of think about it as like something that my friends with young children, pick up, and then it runs through the whole family on its way out. But this winter, it just seems like everyone, including one of my daughters, has had norovirus. Am I imagining that it's kind of picked up, or what?
I haven't seen anything that is super high this year compared to last year. It's always kind of what's in the news. It is always around from November to April at its most concentrated. Typically, viruses, we think about them being winter viruses, but the reality is that they can happen any time of year. What typically happens in winter that makes it easier for viruses to spread is that people are in closer contact. People, like norovirus, can hang out on a surface. People are more likely to be in very, very specific areas that are away from cold weather, where they're touching more surfaces more frequently. And if the surfaces aren't getting cleaned, if you're not washing your hands for at least 20 seconds, for children, when we often talk about singing happy birthday 2 times, that while you're washing your hands. Hand sanitizer doesn't work as well. It's really important to wash hands and use high-grade disinfectant for surfaces.
All right. Well, that's very, very good advice. Like so many different viruses out there, norovirus is a public health issue.
Yes, it is.
So how do you view this in terms of outbreaks, and what are some of the factors, other than you said close quarters, touching a lot of stuff, that are really factoring into this?
Well, it is really, I believe one of its most frequent, as I mentioned before, frequent areas for food settings, because people can be sick, food workers can be sick, but then they come back too soon, and surfaces aren't being cleaned. We frequently recommend, if you are sick, stay home for at least 48 hours after the symptoms are gone. The norovirus can keep shedding for several days after that, but the most concentrated time of shedding after you're better is about 48 hours. So you are still really highly likely to spread it. That was like what happened in our situation. It hadn't been quite 48 hours. My friend was still shedding. And it's really easy for it to get on a surface if the surface is not cleaned. It doesn't take a lot of norovirus particles to get you sick. Again, very highly contagious. So it's cleaning surfaces, washing your hands, really like wiping things down that help prevent it. But yeah, anything that causes outbreak for suddenly a whole lot of people get sick is a public health concern. That's why we look at things like measles and flu and norovirus. And norovirus comes every year and gets a lot of people sick. And depending what's going on, it makes the news or doesn't make the news. I know there was a massive outbreak last year in California. I haven't heard quite that much this year in the news or in the public health record, but there's also been a lot more going on, so it's a little harder for the norovirus information to break through.
So here's a question. I mean, if somebody was in a room with me that had norovirus, I would probably be in a hazmat suit. Say somebody like walks into your office and you suspect as a physician that they have norovirus. Are you taking any special precautions?
We are, like the staff, I let the staff know, and we clean. We've got our high-grade hospital disinfectant wipes, and they clean everything down. And usually we give the room a break for a little bit if we can. But yeah, the first thing they do is they literally wipe everything down. I'm also wearing gloves. We're in the winter rush, we'll mask. Frequently, everyone in clinical settings is required by Rush to mask. Rush is very, very big on infection prevention. And so, yes, we are wearing masks. For my hearing loss, my patients wear clear masks, which is awesome, but they are still masked. But yes, that we really have to just be careful, clean everything down, wear masks to prevent ourselves, not from norovirus so much, but airborne viruses, try to reduce the risk of transmission there. But even still, another quick story, my father asked me recently if they could go to lunch with some friends who had just been sick, and the other man possibly had norovirus, and I said, wait at least 48 hours just in case. And my dad's about to turn 85 this year, so we don't want him getting that sick.
So this is really good because we're going to shift into advice. So
yes.
A, make sure, if somebody's been ill, give them that space,
yes.
At least 48 hours.
At least 48 hours, stay home. Don't work from home if you're able to work from home, but otherwise don't go in, because then one, if you're not fully better, you could just make things worse. But two, if you get all your coworkers sick or your friends sick and they all have to stay home, you're kind of stuck. Particularly at work, you suddenly send all your coworkers home because they got norovirus and you have to do all the work now. So that's not good.
Many incentives not to
many
share
incentives.
That. So we talked about that. We talked about hand washing, especially since
Happy
hand
birthday
sanitizer not as effective.
Right.
Any other kinds of things. I'm a hand washer, and so I try to A, not to touch anything, and B, if I do, I wash my hands.
That's a very good, safe way to go. But yeah, those are really the big things. Wash your hands, clean surfaces, stay home if you're sick. These are common public health measures to keep infection from spreading for most things that are contact related, such as norovirus. Obviously, for different infectious diseases spread through the air that are vaccine preventable, we talk about vaccination to reduce the spread and reduce the illness. We talk about the importance of the masking. Norovirus, again, is different. It spreads through contact. So wash your hands, clean your toilets. If your children are sick, wash your hands all the time. Have a whole big bunch of thick hand lotion on hand, because your hands are going to get dried up for how much you need to wash them.
So even someone like me,
yes.
you're taking extreme precautions all the time. You're kind of defenseless a little bit. It's just bad luck. Pick up a dish, whatever it is, in a restaurant, and let's say you get norovirus. What do you do to take care of yourself?
It's mainly supportive care. Drink fluids like crazy, as much as you can. If you're having a lot of diarrhea, it can be hard. But as long as you're not feeling lightheaded, if you can urinate, have urine, and the urine is not so dark and small amount that it's scary, then you're okay. But if the urine starts looking really dark, really red, not coming out, if you're vomiting and can't keep fluids down, then you usually need to seek attention, medical attention. That's when you need to go in and get checked out, because they may need to give you fluids through the IV, some anti-nausea meds, just enough to help keep your body functioning properly until the illness passes.
And as you said, it's kind of in that 2 to 3 day range.
Yes.
If it's not dissipating by then, would you get in to see a physician?
If it's not dissipating, most likely it's 2 to 3 days. If it's not dissipating after 4, 5, 6 days a week, and you have been able to stay hydrated and haven't ended up in the emergency room because of lightheadedness or other symptoms, chest pain, all sorts of things that necessitate a higher level of care than just helping at home, then usually on the 7-day mark, people often check in. After 7 to 10, sometimes 14 days, we get a little more concerned about a bacterial infection, so something that's not norovirus. So we'll start sending stool cultures. We'll start asking a lot more questions. Have you traveled? Have you eaten raw sushi or other raw foods? We start asking a lot more questions. The norovirus can spread so quickly, but also, as we already talked about, norovirus can be it's usually very fast. So if people are taking care of themselves, we leave them alone. But if it keeps going, we're maybe this isn't norovirus and we need to do other things.
All right, so outside of that time frame, time to see your family physician.
Yes, very least, make a call.
All right. Well, thank you so much, Dr. Bisgrove, for being
Absolutely.
here. I know more about norovirus than maybe I ever wanted to. We really appreciate your advice and how to navigate this. Thanks so much for being here today.
Absolutely.
If you found this discussion valuable, you can support more programming like it by becoming an AMA member at ama-assn.org/join. That wraps up today's episode, and we'll be back soon with another AMA update. Be sure to subscribe for new episodes and find all our videos and podcasts at ama-assn.org/podcasts. Thanks for joining us. Please take care.